Welcome back, YouTube. We'll continue on. Alright, so we left off with talking about the three rectal arteries, superior, middle, inferior, shown on this picture. There's one of those that's shown on a model in the classroom very well. Here's a picture of the superior rectal artery. The blue arrow is pointing to, here is inferior mesenteric artery, and it continues on as, right here, superior rectal artery. So that's the one that you got to know that's shown well in the model. The other two study the picture. We're going to move away from rectal arteries and talk about the inguinal region. If you can't tell what you're looking at, this is a muscular model of the lower limb, and it has this area here called the femoral triangle, a little landmark area within the inguinal region. Inguinal means groin. What I want you to know here, a couple of things. One is a superficial vein of the lower limb. It's the longest blood vessel in the body. It's the great saphenous vein. It runs along the medial aspect of the lower limb, from foot to groin. So note that. Great saphenous vein runs up the medial aspect of the lower limb. It ends by draining into the femoral vein, right here through the saphenous opening. This tissue here is the fascia lata that covers the musculature. Notice this vein is on top of the fascia lata, so it has to go in there to drain into the femoral vein. So, great saphenous vein runs up the medial aspect of the lower limb. Enters the fascia lata. Through the saphenous opening. Draining into the femoral vein. Moving on, if you do a deeper dissection and remove the fascia lata, you get this picture here. Okay. Now this purple triangle drawn in, that's why it's called the femoral triangle. Okay. So remove the fascia lata, get this picture. We can see the anterior thigh with the femoral triangle. Femoral triangle, know its borders and its contents. Femoral triangle. Know its borders and contents. So it's kind of like try to approximate that triangle there. You know, this lateral border, that muscle is the sartorius. The sartorius muscle that forms the lateral aspect of this triangle. This medial border here, they use this muscle. That's the adductor longus. Adductor longus. Top of the triangle, the base of the triangle is the inguinal ligament. Inguinal ligament. And the reason why we want to study this here in the blood vessel unit, know femoral, a nerve, artery, and vein from lateral to medial. Nerve, artery, and vein. Those are the contents. So just went through the borders. They are, again, sartorius, forming lateral border, adductor longus, medial border, inguinal ligament is the base of the triangle. We have femoral, again, from lateral to medial, nerve, artery, vein. Nerve, artery, vein. NAV. Those are the contents. Continuing on, we do have some models in the room that kind of show some of these structures. You can study those in the lab. Something that's called the subinguinal space I would like to talk about, because, I mean, this is how the blood vessels are exiting the pelvis and getting out the front to the anterior region. We studied how, like for example, the gluteal vessels squeeze out above and below piriformis to get out the back to supply the gluteal region. And this subinguinal space is how structures exit the pelvis on the anterior aspect. So let me write what I just said. Structures exit the pelvis anteriorly through the subinguinal space. Structures exit the pelvis anteriorly through the subinguinal space. Basically, it's a space underneath, inferior to, the inguinal ligament. Through the subinguinal space. Well, this picture is showing that space, and there's an acronym, NAVAL, and I'll get to that in a minute. Let me just kind of zoom into the subinguinal space. It's just referring to like this space here. Here is the inguinal opening to the superficial inguinal ring leading to the inguinal canal, but these structures right here are exiting. You already know femoral, nerve, artery, and vein, and that's the first three letters of naval as a memory jogger. Femoral nerve, femoral artery, femoral vein. The E stands for empty space. And the L is for a ligament, lacunar ligament. Okay. The lacunar ligament is a little ligament right there. The empty space right here is usually occupied by a lymph node color green. So that's basically the subinguinal space. Well, I want to focus back on the major arteries that supply blood to the lower limb from the front side. And the main one to follow is the femoral artery. So let's go back up into the ab cavity to abdominal aorta. Little review. Zoom in up on abdominal aorta. Abdominal aorta branches into the common iliac arteries. Again, here it branches into the external and internal iliac arteries as discussed. The external iliac artery will exit, and it will continue on as the femoral artery. So let me write that on the board. The external iliac artery, it exits the subinguinal space and continues on as the femoral artery. External iliac artery exits pelvis, and continues as the femoral artery. Underline that, that's the one you got to know. So here it is here, exiting through the subinguinal space. That's the inguinal ligament right there. Continues on. Once you pass by the femoral head, you know you're at femoral artery. Okay? So here's the femoral artery. Just look for the femoral head as a landmark. That's kind of what I use if I tag it next to the femoral head. You better put femoral artery, not before. That's external iliac. There's one major branch coming off of it called the deep femoral artery. Here it's called Profunda femoris. So let's follow the femoral artery. It's actually going to go all the way down medial thigh to the back of the knee. Femoral artery, first major branch coming off of there. Let's get under here. The deep femoral. Also known as named here, Profunda femoris artery. To be profound is to be deep, that's the same thing. Profunda femoris artery. Same thing. Now on this picture you can see there's some branches of the deep femoral. This one here and this one here. There's the medial and the lateral circumflex femoral. There and there. Know those as branches coming off deep femoral. And notice how they connect around femoral neck. That's called an arterial anastomosis, to form a loop around the femoral neck. Let me write those branches down. So, coming off deep femoral, you have medial and lateral circumflex femoral. Count those as two, okay, branches, but they form a loop. So you have medial as well as lateral circumflex femoral arteries. And what I had said was they wrap around the femoral neck, forming an arterial anastomosis. Wrap around the femoral neck, forming an arterial, I'll write the last word down here, anastomosis. That's when you get one artery running into another artery. Now continue on here. There's a blank figure you can study. Let's continue this picture and let's see where it goes. Okay? Here's a picture of like the knee region. Where we left off was femoral artery. The femoral artery is going to pass through this space called adductor hiatus. You zoom in on that. The femoral artery passes through adductor hiatus, a space in adductor magnus muscle. There's the tendon of adductor magnus, at least one of them. Artery passes through there, goes to the back of the knee for protection. Imagine if you had a major artery on top of your kneecap. That wouldn't be very safe if you fell down. So following the femoral artery, femoral artery passes through the adductor hiatus to, I'll call it, posterior knee. And the name changes to popliteal artery. So I'll say becoming popliteal artery. Sometimes pronounced popliteal. I don't know if there's a correct pronunciation there. But pretty much it's called that because the posterior knee region is called the popliteal region. So the artery has the same name. And the artery didn't change, just its name. It's kind of a little confusing thing there. Well, anyways, that's what we got in that picture. Here's a picture of a model showing you the anterior leg. And here's a picture of the anterior knee and leg. And so what we had talked about was how the artery is behind the knee, but it does give off branches, and one of those branches has to come to the front of the leg to supply blood to the anterior compartment, and that is the anterior tibial. So let's just kind of back up a little bit, just a minute. So we started off with femoral artery. I'm going to color it in green here, right there. And it's passing through the adductor hiatus. When it gets to the back of the knee, change my color, say to blue. So that's behind the knee. It's the popliteal artery. It gives off one branch that goes to the front. It pierces this interosseous membrane between the tib and fib, and it's the anterior tibial artery. Let me see if I can give it a different color here. How about purple? So that purple line, I'm trying to trace that red line, is the anterior tibial artery. And here it is on this model, that red line there. Stands out a little bit. Let me just trace it with my finger. Anterior tibial artery. Okay. So before I take notes on this, let's kind of like look at this from behind the knee. So once again, here's the adductor hiatus. So when the artery passes from front to back, here's popliteal artery, and we can see it branch right there. Let me zoom in on that. Here's popliteal branching into posterior and anterior tibial artery. We can see anterior tibial artery, it's back here. It's piercing the interosseous membrane to go to the front. So let me write that down. Following popliteal artery. Popliteal artery. It's branching in the popliteal region. Branches in the popliteal region into posterior tibial artery, well, the name tells you where to locate it. Posterior leg, look for it by the tibia bone, and the anterior tibial artery. And again, the name of the blood vessel tells you where to locate it, anterior compartment of the leg. Here's a picture of a model showing you the Popliteal Fossa, and you can see the major artery back there. Here's a simple sketch. We can see that the Popliteal Fossa, Popliteal Fossa, is a diamond-shaped region. Let me kind of trace it so you can see the diamond shape. Created by the gastroc bellies and hamstring muscles. Well, anyways, here are the contents, and you can see the major nerve artery veins here. Popliteal artery and vein, red and blue respectively. And here's the nerve sciatic, kind of bifurcates into its two divisions, the tibial and the common peroneal nerve. I want to ask you about the nerve. This is a blood vessel unit, but that's the popliteal region on the back of the knee. This next slide shows you that this branch of popliteal artery, it occurs usually right after you pass the popliteus muscle. That's what I say here. These branches begin just inferior to popliteus muscle, if you want to write that as a landmark to find that bifurcation. Let's continue on. You know, these arteries, the posterior and anterior tibial arteries, they kind of like go all the way down to the foot, and that's as far down as I want to go in terms of blood vessels you got to know for the lower limb. I'd like to go back up to the upper limb and talk about blood vessels that supply blood to that, starting with the shoulder or axilla region. The whole thing's the upper limb, but we're going to start with the most proximal attachment to the trunk, the shoulder. If you abduct the arm, abduction, we can view the axilla. So moving on to a different region, done with lower limb blood vessels. Now title this upper limb blood vessels. In this picture here, the man has his arm abducted, and we can view the axilla, which can only be viewed when the arm is abducted. Axilla, which pretty much means armpit region. Can be viewed with arm abducted. When you do that, you can kind of see the boundaries of the axilla. I won't necessarily test you on this, but you should know it. You've had the anatomy. When we say posterior fold, just think about the muscles in that fold. Basically, lats and teres major. Anterior fold, pec major, pec minor. Medial wall, you got ribs, you got serratus anterior. Lateral wall, what do you have here? You have, this here is called the medial bicipital groove. You have the humerus. There's a slender muscle coming off here. It's the coracobrachialis. Just some things to mention. Anatomy you can review if you like. So that's the axilla. Can be viewed with arm abducted. If you adduct the arm and put arms together, you have the shoulder region. And there's a blood vessel running in this region I want you to know. It's the cephalic vein shown here in the picture, here in the model. It's very superficial, just skin deep, right under the sub-Q. The cephalic vein runs in the deltopectoral groove. That's what I want you to know from this picture here. So the shoulder region, be able to identify the cephalic vein. It runs in what's called the deltopectoral groove. It's going to like drain into axillary vein, but let's just kind of ID it right here in these pictures. Superficial vein, easy to identify. Here's a picture of that model in the classroom. Here's a picture of this of the axillary artery. Okay, and let's learn the limits of the axillary artery. Understand in this picture we can view it, but know that axillary artery is a continuation of subclavian artery, which was taught in head and neck vessels. Okay, but this is the artery that's going to get out of the neck and into the arm to supply blood to the upper limb. So what's called the axillary artery limits. Remember, the artery isn't changing, just the name is changing. It begins at the lateral border of the first rib. Now, you really can't see that first rib here, but I'm just kind of pointing to where it would be. Begins lateral border of first rib, and it ends at the inferior border of the teres major muscle. I'm pointing right at it. There's last, but there's teres major there. You can kind of see the insertion right there. Ends the inferior border of teres major. It's a muscle. Those are the limits. Know the limits. Know these landmarks where the artery changes the name. So remember, the artery was subclavian, became axillary. I mean, after it ends, it's going to continue on as brachial, which we'll get to. Okay. Other landmarks. So in this picture, we can see first rib. Here it is right there. I kind of colored it in purple there. Right, as soon as the artery subclavian passes it, now it's axillary. And we can use pec minor as a landmark muscle to divide this artery into three parts. Basically just first, second, and third parts. Okay, notice how pec minor, it's kind of forming a bridge over the artery. So it's kind of a useful thing to know. So continuing on with axillary artery. Next point to know, pectoralis minor can be used to divide this artery into three parts. Pectoralis minor can be used to divide the axillary artery into three parts. Well, you can see the three parts, 1, 2, 3, pictured there. Let me kind of define these three parts. Three parts of axillary artery. First part, it's medial to the muscle, medial to pec minor. Second part, by definition, is deep to it. Deep to pec minor. The third part, lateral to pec minor. Lateral to pec minor. Okay. Well, it turns out there are many branches of the axillary artery, but the major ones that we have students know in this class all branch off the third part, The third part has, conveniently enough, 3 branches, and they're listed here. The anterior and the posterior circumflex arteries. Anterior, posterior circumflex arteries, they wrap around the surgical neck. Normally, those 2 muscles, they kind of meet. They kind of like connect and form a loop around the surgical neck. I don't like that this picture doesn't show that, but you'll see it on models, so let's kind of just note them. So 2 of the 3 branches you got to know, the third part, are anterior and posterior circumflex humeral arteries. So AA, arteries, 2 arteries, and again, they form an anastomosis too. They're very homologous to the lateral medial circumflex femoral arteries that branch off the deep femoral. Those wrapped around the femoral neck. These wrap around surgical neck. Wrap around surgical neck. If you recall, this area here, put a purple line across it, it's called the surgical neck because it's prone to fracture. There are 2 necks in anatomy. There's anatomical neck, top purple line here, right after the head. We call that the anatomical neck because neck always comes after head. Like you have a head, then neck. So if we have the humeral head, there's the anatomical neck. Then another neck, when the bone kind of narrows, where it narrows, it's kind of weaker and prone to fracture. That's why it's called the surgical neck. We're concerned about it because these blood vessels are right around that area. If you fracture, you worry about rupturing the blood vessels. The third branch you got to know, subscapular. This major branch going here. Okay, it's going to be underneath the scapula there. Subscapular artery. It's the largest branch of the axillary artery. We want you to know it. Be able to identify that. Subscapular artery. Here's a picture of a model we have in the room. I'll zoom in. There's like these black arrows, might not be able to see too well. Those 3 branches that we just took note of. Subscapular, and then the anterior, posterior, circumflex humeral arteries, better studied in the lab. Let's look at the arm. I'm going to talk about some superficial veins of the arm. There are 3 that we expect you to know. They're shown on pictures and models, like this one here. Superficial veins, UL. Upper limb. Notice that the superficial veins, my hand is underneath all the superficial venous system. Notice there's no accompanying arteries with these superficial veins for protection. We want arteries protected. I'll put here, have no accompanying arteries. The 3 you got to know. It's kind of hard to see here. You can study this model in the lab. Maybe this picture will help. Running along the lateral aspect of the arm, we mentioned it before up in the shoulder, runs all the way down the lateral aspect of the arm. Cephalic vein. Note that one. So first one, cephalic vein. Look for it on the lateral aspect of UL. the medial aspect of UL, look for Basilic. These are both going to drain into the axillary vein, or really close to it. You can't see that here though. You just look for them. Basilic. Look for it on medial aspect of upper limb, UL. Now, in the crook of the elbow, basically the front of the elbow, you know, the front of the elbow is like the back of the knee. There's a slight depression there. The back of the knee was called the Popliteal Fossa. This is the Antecubital Fossa, or sometimes just Cubital Fossa, where you have a vein that connects cephalic to basilic. It's called median cubital vein. So note that. So look for it in, antecubital fossa, sometimes ACF for short. Front of the elbow. Typically, the median cubital vein, that's the one used for blood draw by phlebotomists. And here's a picture of, like, you know, that same picture next to this arm. Study the model in the lab. Just look for those three when it comes to superficial veins. Don't forget about the veins down here, though. We'll get to those. And let's talk about, go back to the main artery, and talk about the continuation of axillary artery, brachial artery. Okay? So, in the surface anatomy, in the brachium, the brachial artery runs in the median bicipital groove. Here it says just bicipital groove, but you should insert the word median there to make it correct. Here it says, going back to the main artery of the arm, brachial artery. Because the brachium is the arm, that's the arm region. So, brachial artery runs in the median, I should say medial bicipital groove. So that groove kind of approximates its location deeper. If you look at a dissected picture, you can kind of see it there. Here we see the limits of the brachial artery, where it begins and where it ends, cubital fossa, or antecubital fossa, as I just wrote. So the limits of this artery, where it begins where axillary artery ends, at the inferior border of teres major. It ends about an inch past the ACF. About an inch past the ACF. The antecubital fossa, the figure just says cubital fossa, it's an abbreviated name of that, you can call that if you want. Here's a picture of the model that kind of shows that nicely here. Again, the models, pictures of the models I usually don't teach from. I just want you to know, hey, grab it in the lab and study it. This illustration is easier to teach from in this talk here. Here is brachial artery. It ends about an inch past cubital fossa. Here's about an inch past cubital fossa. It ends by bifurcating into radial, ulnar arteries. brachial artery divides or bifurcates, keep using that word, bifurcates, into the radial / ulnar arteries. You know, the arteries are named for the bones of the forearm. The radius bone, the ulna. And these blood vessels run all the way down to the wrist and to the hand. They give off other branches here, but again, this is as far as I'm going to go. Like in the leg, I went as far as anterior posterior tibial, that ran down to the foot. It's kind of like I'm stopping in the same place for the UL. I do have some pictures of cubital fossa. If you just look at this region with the skin on, we can kind of see superficially 1 cephalic, 3 basic, 4 median cubital, just under the skin. If you remove the skin and dissect them, you can see those 3 again, just in the ACF. Cephalic laterally, basic more medial, and connecting the two, median cubital vein. In this dissection, we can kind of see a full view of the biceps brachii, and I'm just kind of pointing to different muscles that you should have studied in Biology 430. But you can see the artery that we're interested in is right there. The brachial artery runs with the median nerve. Okay, so if you ever see that, I'll put that as a side note. Runs with median nerve in the ACF. Here's a picture of the deepest dissection, just so you could see the artery bifurcating into radial and ulnar arteries here. So you can kind of zoom in on it. Right there is at the end of the brachial artery, dividing into radial and ulnar arteries. I put the 3 side by side just so you could view. In the superficial dissection, you can't see the artery, but if you remove some structures in this picture here, you can start to see the brachial artery and get the clearest view here. So if you follow the radial ulnar arteries to the distal forearm, you get this picture here. Here's the hand, right? This is my right hand, and so that's the thumb. That's the thenar eminence, hypothenar eminence. You don't got to know that, but be able to identify these arteries here and here. In blue here, that's the thumb side. That's like, hey, that's radial. That's always how I remember. On the thumb side is radial, and the other side, use a different color, green. That's ulnar, on the pinky side. And you form these palmar arches, and there's other branches that are given off that I'm not going to hold you responsible for. Just be able to identify the radial and ulnar arteries. Okay? All right, that concludes the anatomy of the blood vessels. See you in class.